for the opportunity to be joining you on this very exciting day, and to all of us who are here on this video conference around the globe. I'm looking forward very much to the opportunity to be sharing alongside my colleagues and those that we see as part of the modern aging community of what are the changes we're seeing in aging and technology. But perhaps before I just start on the presentation, Janice, if it suits you, a few minutes on, as I think you were mentioning, what would we like to see changing in the future of aging? And to that end, clearly awareness is a big factor. We do see it inside the community of Aging Asia, people that are coming together from all sorts of different organisations, government positions and not-for-profits alongside our citizens in the Asia-Pacific region and globally more broadly. But we would like people to appreciate, and businesses and governments to grapple with the magnitude of what's in front of us. More than 1.5 billion people over the age of 65 by 2050. Many of those people are residing in the Asian region. And importantly, the consumption patterns of people over the age of 65. In US dollars, what is currently $8.4 trillion will grow in the next 10 years to 14 trillion US dollars. These are markets that cannot be denied. And it's important that leadership like yours, Janice, and others assembles itself around what are the right ways in which we will innovate and deliver products and services of scale to people that truly changes their needs. So for us, what we'd like to see in the future is more co-design, more genuine, authentic, internationally accredited co-design with older people at the centre of the concept discussions and ideation through to prototyping and all the way through to products to market, and including other products that may be in market that need to be adapted or could be adapted to support the way in which we all wish to live and grow in our own personal pursuit of aging well. To do this, we're going to need evidence-based research. Too often around the globe, ageism gets in the way of good design and good decision-making for communities, for countries, but sometimes also for our individual citizens. We need to make sure we have the right evidence-based information at our hands that is current and really leading indication of the future trends required. And importantly in this equation, we want to speak about the importance of gerund technology and age technology as a response to this. And in my presentation shortly about the GCMA, I will speak to that point. So my final comments, I think, about what we'd like to see in the future of aging is more stylish, affordable and functional products and services that can be bought either by governments and then procured for people who have the need and the means, and also for those who can afford to buy their own, to have the right sort of products and services at the right price points. Increasingly, we are seeing people wanting to live at home for longer, and when we are in our age residentials or in our villages, it's important that it represents home as much as possible. And as the market supply chain moves closer to understanding and responding in that way, where we always have a foundation of care, but also support and enablement, it will help people to age longer. So our wish list at the Global Centre for Modern Aging is increased awareness by not just those traditionally in the sector, but by those who sit outside and could very much play a meaningful role in the decades to come. And that co-design with older people, their carers, their families, their friends, and the workforce intricately involved in that co-design placement. Thank you. If it suits you now, I will pass over and I'll share with you a slide presentation from the Global Centre for Modern Aging that represents a little bit about our business and where we see the opportunities in the future. Okay, is that visible to the screen now?
We're just giving it a few moments and we're waiting for the connection to come in as Julian's slides will be played soon.
Oh,
Julian, can you try to reshare again?
Yes, thank you, Janice. Thank you.
Yep, we see your screen right now, and you can share slides.
Thank you.
Okay, thank you.
My apologies for the delay. Thank you for your patience. So as we've mentioned, this is the Global Centre for Modern Ageing, and as our business, as Janice would know and others that we've worked with in the last few years across the Ageing Asia community, our role is to inspire and equip governments and enterprise and citizens to come together with their research partners in order to understand the changing needs and wants. Increasingly, we see the importance of localization, so products and services that are prepared and delivered in one country or in one particular community and wishing to be exported to other markets. How do we ensure that we adapt and listen to the needs and wants of people in their real life settings is an increasingly important part of the global supply chain. So we can take advantage of the investment and the thoughtful product development and market segmentation that's been taken place by organisations and governments and entrepreneurs. But at the same time, ensure that when the product is taken from one region to another, that it meets the fit for purpose and that we include all of those stakeholders so intricate to the experience on that day as they consume the product or the development. And our role as an organisation is to help disrupt some of the conversation around the globe and to understand and appreciate and celebrate older people and our individual pursuits for how we wish to age well. We'd like to do that by bringing together the market forces and helping to facilitate the market research that informs existing and new entrants to the market. And through the services of our LifeLab, which I'm about to explain to you, and our work that has been undertaken in Hong Kong, Israel, Singapore, and increasingly into other components of the Asian region, including clearly Australia, our work of being best in breed and best of class. So we're very pleased to be the prize of choice in the Elder Care Awards this year, where we help to provide entrepreneurs with greater clarity or organisations as they understand more fully the market needs and acceptance of their product as it stands today and how it will be created to create even more higher levels of satisfaction and adoption. And we're based here in a physical presence. We're based at the Tonsley Innovation District in Adelaide in South Australia, but indeed our work is carried out in real life settings in many places around Australia and in Asia itself, including in Hong Kong currently. This is a picture of our LifeLab, which is where I'm located today. And, you know, we have 19 cameras and sensors, a fully working kitchen, and it's a simulated studio, which allows us to take prototypes of products and test them. And whilst universities will often be a commonplace for testing the technical functionality of a product, our testing is different. It's about an observational deck where we look at the experience and the encounter, the ease of use, the delight, and if it did meet the needs and wants of people involved in the exchange. That's not limited just to older people. Clearly, on many occasions, there are carers, families and friends involved, as well as perhaps allied health professionals or indeed other workforce chains. It's a really exciting, fun place to work, and we're very pleased to be able to offer that to many companies and governments. This is an example of where our work is currently being exchanged at the moment and where some of our international expertise sits in terms of our global team based in London and in Switzerland, but also here in Australia, and taking projects to and delivering from countries that I've mentioned earlier: Israel, Singapore, Hong Kong, and I believe Japan is due to start shortly. Here we are. We understand, as you do, the global reach of the market, and as I mentioned earlier, $8.4 trillion growing to $14 trillion. It's very important that that money is spent wisely and thoughtfully around the globe, and we believe that initiatives such as the forums that Ageing Asia pull together each year, and also the supply chain of many, including companies like the Global Centre, play a really important role to ensure that that money, which of course money is a finite resource, is spent as well as possible to ensure better supply chains of the future. We run with a whole lot of different methodologies. Many of us on this call would be familiar with focus groups, of course, a very common way of understanding. But you'll see there through our work of a range of a palette of methodologies and tools that we use, increasingly remote observation as during the last 2 COVID years. And that has allowed us to undertake projects from afar that still need development despite restrictions of personal travel. I think it's really important when we talk about technology, we need to think about it in the terms of gerontech. So gerontech, and it's often referred to as age tech, is the diverse group who include health clinicians, care workers, aged care management, older people, their adult children, and professional designers who, actually draft the blueprint. They all work in conjunction to harness user principles and experiences to ensure that the design principles meet the user needs, and that's very much part of the guiding principles of co-design. And when we talk about age tech or gerontech, which is the bringing together of technology with older adults or the most elderly that we have in our communities, is what's required is the integration of technology into the existing workflows and the legacy that can be had by technological infrastructure. So how do we prepare our organisations for the future when our systems and processes might be, and the skills of our management team might be from a period from more relevant in the past than into the future. So the workflow is a very important component of the change that we see and require across all of our work. I think the important component here for aspects such as the tech in the team is that the opportunities to improve are here and now. The way in which we govern ourselves to collaborate and design appropriately will be key as to whether Australia and others are true leaders in the future of aged care globally. And we believe that well-accredited specialisation that supports leadership of the change that's catered to older people and the elderly, as I described earlier, at the design of all of the improvements is essential. I would like to speak with you now about, some of the partnerships that we see in this care provision. And as you'll see there on the screen, and it's not limited to those 3 players, if you like, or actors in the equation. You see, as technology has evolved, a new intersection is emerging, and we're reshaping who delivers health and aged care and how this care is delivered. So technology providers, that's the developers and the vendors, are now key players most effectively when they work in collaboration and form partnerships with health and aged care providers. Consumers are increasingly part of the collaborative delivery process because of their increased ability through technology to monitor their health status and share findings with their care providers. And also, therefore, to self-manage some of their care and support. This is an increasing part of the difference of how we are able to monitor our health status into the future. Again, this is most effective if there is based on a partnership of care to ensure that the technology involved is appropriate, and if that technology has been co-designed with the end users in mind. For the first time, each of these 3 stakeholder groups has become a co-provider and a co-supporter of the initiative. And at our presentation that we'll be sharing with you on October the 1st, we will be bringing together 3 good examples of the tech provider platform and a care provider alongside our governance and global position to share some of the insights for ageing and technology. So when we explore this further, we're looking at the importance of co-design and tech, but also the workflow. It's so important for when people are living in managed and controlled or supported environments, which is the case around the globe for many people as we age. So in some recent work, and this was some Australian studies, but I think it's an interesting report to compare and discuss with our other counterparts across the Asian region, is that in the Aged Care Industry Technology Council's 2020 Care IT report, it assessed the stages of digital readiness in the aged care sector. And there were 9 recommendations. Recommendation 5 was the development of a national network of living labs to co-design new innovative service models, workforces, and tele-technologies. The adoption of telehealth, telecare as part of a standard care requires a range of non-technical interventions, in particular, a structured approach to its integration into workflows, into the standards and the systems. The same principle applies to their integration into the daily living activities of older people living in the community. So accompanying this integration is the need for workforce training and development and the redesign of existing models of care. And I think we'll see a lot of that conversation being explored and discussed through the many and rich sessions that the Aging Asia team have put together for us, where we can learn and compare and improve based on the many sessions that leaders around the Aging Asia community will bring and the ideas that they'll share. Of course, we're very pleased to also this year, as part of our contribution to presenting in 2 or 3 sessions, but particularly on the first day, talking about ageing and technology. We're delighted to also be supporting as the prize of choice for the winning Global Aspire in the entrepreneur category and in the elder care, one of the elder care categories as well. So that in itself is a support of the work of Aging Asia and a celebration of the leadership that it's shown in the years leading up to 2021 as we enter into this very exciting October session. I'm looking forward to sharing many of the experiences with you throughout the very exciting 20 days, and as an international judge to have the opportunity to witness some of the great work of the last few years being brought to the table to share and to celebrate the intention, the effort, the intuition and the collaboration that is so required as we provide the needed products and services of the future. As people, whether we live in residential homes or we live in villages, community settings, or we live independently at home, improving the breadth and the depth of quality choices at every stage can only bring about a better community. And yet we know that resources such as money are finite. So how do we work hard on low cost, high volume, affordable solutions that bring about great scale and impact, at the same time thinking about the market service needs of others that do have the propensity and the ability to pay. And so for us at the Global Centre for Modern Ageing, we're interested in the equation of age tech specifically, but not limited to that, and how we can work together to unravel some of the intricacies of technology and move it more towards a more intuitive and people-centered response. And when we're able to do that, we won't only see organisations being filled with products and services that more meet the systems and the processes that they work within, so their boundary conditions, but also we'll see higher adoption of aging well products and services because people will like them and people will want to work with them, not just the patient or the resident, the care and family, but also, others inside the whole response. And when we see increases in adoption of aging well products and services that improve components, then we will definitely be able to experience better changes in the way in which people live, work and play. And to that end, I'd just like to finish on a few examples of some of those products that we're seeing in field. So in particular, when we talk about technologies, we're thinking about that could be optimized further through co-design. It's telecommunication services such as telehealth, health and monitoring devices. So the internet connects the glucose monitoring or scales and stethoscope described. The social and assistive robots, so providing companionship or monitoring health and monitoring falls. The smart home adoption, so developed initially for reasons other than enabling aging in place, but they're now monitoring and regulating energy use. There's medicine management, And that's not just limited to automated pillboxes, but these are great because they've got reminders that you can have through your apps. And the wearables, and this lends itself to beyond the well-known and well-spoken about fall pendants, but into medical grade insulin monitoring and dosing patches, non-medical, such as smartwatches and detecting cardiac information or falls. So underpinning those technologies that enable the above mentioned list of the technologies are things like sensors, so to detect the movement or lack of, and the appliance usage or temperature. The Internet of Things, so expansive, isn't it? That's the devices connected to the internet and other than computers as part of the smart home system. And cloud technology, transmission of biometric data from home to clinic. Voice activation, which has the potential to narrow the digital divide. And the artificial intelligence and machine learning for personalization and to recognize physical and physiological variations from established patterns. So these are super important components of not just the aging in place technologies that we have, but the underpinning technologies that enable those technologies to do their job. And on October the 1st, following Janice's opening address and welcome, we'd be delighted to share with you more of an exciting conversation featuring Dr. John Beard, the ex-Global Director of the World Health Organization for Aging Well, alongside Chief Member of Hammond Care here in Australia, and also David Eglin from Google Chrome and myself. And we look forward to sharing with you a globally expansive and current and future-looking perspective on aging and technology. Thank you for the opportunity to share with you today, and I look forward to many encounters in the month ahead in October.
Oh, fantastic. Thank you so much. And we're very pleased to welcome Julian Parkinson from Global Centre for Modern Aging from Australia, and we look forward to more insights. So any of you with questions, feel free to write into Aging Asia, check us out on LinkedIn and all our social media channels, and we'll stay in touch because there's going to be lots of exciting, excellent insights coming out from Global Centre for Modern Aging's special session by Julian Parkinson, and you'll hear more of that in the leading weeks to the World Aging Festival. Thank you for joining.